Hemochromatosis, also known as an iron overload, is a genetically inherited condition which involves an individual developing an increased iron intake from regular practices. This is caused by a mutation to the HFE gene on chromosome 6. The human body is only set to take as much iron as it needs, meaning we have no system excreting excess iron. As a result of this, when an overload is present, iron is stored in organs and joints of the body, sparking various cancers and damages. As a direct result of iron overload, various physical symptoms are exhibited throughout the body. Hemochromatosis often lasts for a whole lifetime and gets progressively worse with age. Some physical symptoms exhibited within the affected individuals include joint pains throughout the body, liver disorders and cancers such as cirrhosis, diabetes, discoloration of the skin, sexual disorders such as impotence in men, as well as absent or scanty menstrual periods within women, a decrease in bodily hair, impaired memory, and severe irritability. These symptoms and the severity vary between individuals, however measures can be taken to reduce effects and impacts. Hemochromatosis occurs as a direct result of a mutation within the 6th chromosome. Within this chromosome, a gene called the HFE gene usually undergoes one of two common mutations, C282Y or H63D, to cause hemochromatosis. Hemochromatosis is a recessive gene disorder, meaning in order for a mutation to occur, an individual must inherit two abnormal genes from their parents. However, only around 25% of these children with carrier parents develop the condition, with others becoming carriers or having no trace of the mutation. As the condition is recessive, the carrier, a person with one abnormal gene, cannot develop the condition. However, their children are at a minor risk of developing, depending on their partner. With this hereditary condition being recessive, it can be hidden between generations and is continually passed on. This is best shown in a pedigree chart. As shown in the chart, the two carrier parents breed. Their offspring has a 50% chance of becoming a carrier, a 25% chance of becoming mutation-free, and a 25% chance of developing hemochromatosis. Even in the generation after, the same chances apply, but only when both parents have the recessive trait. A similar example is also evident in this Punnett square, revealing the nature of recessive traits. A doctor will diagnose hemochromatosis based on family history, a physical or medical exam, as well as results from blood tests and procedures. In order for iron overloads to be detected in a blood test, they must include transferrin saturation, TS. TS shows how much iron is in the body through carrying it through the blood, giving the doctor a general idea of how much iron an individual holds. Liver biopsies and genetic testing are also effective measures for diagnosis. Treatment involves the removal of blood by venesection, also called phlebotomy. Blood is removed at regular intervals and the amount and frequency depending on the overloaded amount. After normal amounts of iron are established, the individual continues to take periodic venesections throughout their lifetime. This product is performed by GPs at the hospital or at a pathology company. There have been several new developments as a result of continued research in the therapy of hemochromatosis. Various trials have been undertaken and an ion chelation therapy is beginning to emerge. Chelation involves the binding of small molecules to iron ions. Chemical ion chelating agents such as desferrioxamine allow the excess iron to be excreted through urine. This and similar chemicals will have to be administered at an infusion center or periodically overnight. This technology is yet to become widely available in all countries, however it has potential to become an effective treatment measure. This development is a great indicator for what future treatments may come. Hemochromatosis is one of the most common genetic conditions which is found throughout the world. It affects predominantly Caucasians and is generally found within about 1 in 300 people worldwide. Although the condition is effectively treatable, many people with extreme cases suffer organ problems throughout their life. Increased funding is imperative for individuals in their treatment. This funding would be used to further develop treatment measures and possibly develop a cure. See this bibliography for references. Thank you.